Hard to believe we're starting week 6.
Yeah, well, halfway there.
I don't know where the time goes. All right, let's wait for missing about 5 students. Let's wait a couple more minutes and then we'll get going.
Celine Broussard.
Okay, all right. Thank you.
Yes.
Can you get that? Can you put your name in the where it says student?
And the student? What do you mean?
It says student on your name when it comes up on Zoom, and it needs to say your name.
Okay, let me try figure out how to do that here.
Okay. Okay, it looks like we have everybody here. Celine, there's 3 dots. Let me see if I get this right. 3 dots at the bottom left of your phone, right? If you click
I
on
know
that,
in
it
my
says rename.
let me see, because I know in my phone, I am my computer. I see the 3 dots. This show me only the chat. It show chat previews. It's the only way to say the 3 dots.
Anybody assist Celine in changing her name on the screen?
Well, I know when you first join, before you join, it should be where she can type in her name. She might have to go out and then
Let me try again because I don't see this. What did
Also, you can look at your picture like up at the top, and if you hover over it, it'll say mute, and then there's 3 little dots, and you click on the dots and then scroll all the way down, it'll say rename, and then you can type your name in.
Let me see. Let me see. No.
You can also go to participants and you'll like see it should say like student, or you're like at the top.
I
If you
got it.
press, yeah.
This
If you press more, it says rename. It says add pin, and then under it says rename.
yeah, because I see my name in the chat. I click the 3 dots. I say copy, quote, and that's it. Let me check again.
Do you want to go out and come back in again and try
Let
and do
me
it?
try. Okay. Yes, because I'm looking here and this not show.
You could just click on your name, like go to the participants and click on your name. And
Can you find the participant list?
Yes, I am in. Not show my name.
Does it show student?
Student me.
Because that's what you're
okay.
listed under.
Rename. I got it.
Okay.
I got it.
You got it?
Yes.
Okay, great. Oh, there you are.
Thank you.
Okay, you're welcome. All right, so hi, everybody. Welcome to week 6. Hard to believe we're in week 6, but we are. This term is going by crazy, crazy fast. So a couple things today. I would like to cover the week 6 content from your notes that I sent you in your announcement over the weekend. And then I'd like to have a look at the HESI prep guide. Okay, so everybody have that pulled up on their desktop because we're going to try and complete or at least identify what we can complete so far and explain the guidelines for this HESI prep assignment. And then if we have time at the end, I'd like to pull up the exam 2 concept guide and review how that's organized and what concepts we're going to be looking at for exam 2, which is next week. You'll be taking exam 2 at this time next week. We have review sessions this week. I'm doing one tomorrow afternoon after class, and then I believe you have to check the master schedule. I believe it's Thursday and Sunday. So there's 3 live exam reviews. You've had that calendar for a while now, so I'm not sure if you're planning on attending. Hopefully you are. And then you'll have a copy of all 3 of the recordings after we do those. Okay, so as I get the recordings from the other instructors, I'll get those to you. Okay. We're in week 6, so how are you guys coming on your group assignment?
Good. We're good. Come on, good.
Well, everybody at least made contact with each other and know what they're doing.
So you want the assignment, everything in one context, or you want separated each one who do the
Nope.
his own part?
Nope, look at the guidelines. I need one final paper from everybody, the same one. So I realized that
Okay,
in Celine, in your group, I'll be getting 4 copies of the same paper. I don't want individual submissions. I need you to put it together as a paper from your group, preferably with a cover sheet that says who your group is and who your participants are. Okay?
okay.
And if there's any issues going on with students not participating or you're not hearing from students in your group, you got to let me know. Okay, I don't want to be dealing with this next week when it's due. So if there are any issues, please let me know ahead of time and I will try and help. I'll try and help problem solve. Okay.
Okay.
Pardon me. Have you guys started working on your HESI prep, or is it blank? Hopefully you started working on it.
I start to work on it, but I'm not sure is this the context how you like to
Okay.
have in.
All right.
So I
We'll go-
prefer you give it to us a sample, how you want, or if you can review mine to tell me if
Okay.
it's okay or not.
I could actually provide a sample from last term or the term before to you guys. Yeah, let me think about that. And then you also have your vulnerable populations assignment coming up in week 10. I know we're only in week 6, but as I said, in week 1, it's going to start to get busy around week 8. Okay. Weeks 9, 10, and 11 are extremely busy for you guys. So there's not much to do these next couple of weeks, like this particular week in week 6. Well, last week in week 5, all we had was the quiz. This week, we have an NCLEX assignment and a quiz. Next week, we have the exam. Okay, so once we get to week 8, it starts to get busy. So I just want to check in and see how you're all doing on those 3 assignments, the group project, the HESI prep, and then the vulnerable populations assignment. Okay, so please be working on those. Okay, to start off with, let's take quiz 4. It's opened up for everybody. So it is 3:09 I have. So let's take 15 minutes to 3:25 and everybody take their quiz. You got to stay on camera. If you're finished, restroom break, whatever, go get a drink, but please keep your cameras on. Okay, so go ahead and take your time and take quiz 4. Quiz 4 covers the concepts that we're going to be talking about today. All right. How's everybody coming? Anybody still working on it? Okay, we'll wait for the rest of the group to come back and then we'll go through it. Make sure you hit submit. I think there's a few students still working on it. So I said I'd give you guys till 3:25, so a couple of minutes. Okay. Looks like everybody's done. So if you guys could come back on camera, that'd be fantastic. How'd you do? Did you do all right? Okay, let's go through it. Okay. Everybody back? I think so. Let's double check. Who else? We have everybody? Okay. All right, let me share my screen. Okay, can everybody see this?
Yes.
Okay, great. Okay, so we're covering occupational health this week, environmental health this week. We are covering, let's see, barriers to learning and reinforcing health education. Okay, so these questions revolve around that. So the first question is an environmental health question. So what statement is true regarding children and environmental health hazards? Did everybody get this one right? And understand why that's correct? Why is that the correct answer?
Because the most closest on the ground is
Yeah.
more higher the risk for health hazards, toxic things, animals, many hazards.
Yep. Excellent, Celine. Excellent. Okay. Question number 2. During a home health visit for a pregnant client, again, this is another environmental health question. The nurse notes that the client's husband regularly uses pesticides. Okay. And so which nursing intervention is a priority? So there's several cues in that question. Okay. The client is pregnant. The husband is regularly exposed to pesticides. And the question is asking which nursing intervention is a priority. So there's actually 3 cues in that question.
The priority is protect the pregnant client,
Correct.
and for protect her for the toxins he bring, he must to remove the clothes outside of the house because he is working on it
Correct.
with regularity.
Did anybody select B? B is a common answer that students will select. It's not that B is incorrect. Okay. It's which is a priority. Okay, so the priority is A. Make sense? Okay, question 3. Home health nurses working in a community with high rates of complex chronic illnesses and neurological disorders. Again, an environmental health question. Which environmental characteristic is priority? So again, a word that comes up, it's a priority question. So did anybody select anything other than C? Okay, A could be correct.
Well,
Right?
there's guardrails, so.
Well, but for
Yeah,
accidents. Okay, B,
Same
B,
because the water have sometimes more pollution.
correct. But they're asking a priority. So if you're living in a community that has several manufacturing plants that are near the community's river, there may be contamination. Okay. We don't really think of, we'll get to this when we talk about the content, but we don't really think about all the environmental risk factors around us. The nurse is reinforcing education to the diabetic client, which client statement indicates a barrier to learning. So what kind of question is this? Is it a positively asked question or a negatively asked question?
Negatively.
Negative.
Negative. Why is it negative?
It's a barrier to learning.
Because you're looking for something that the client says that's either incorrect, right? Or requires further teaching. So D would be the correct answer. I think I would rather use a keto diet instead of this one. Well, remember in the question, they have diabetes. So a keto diet's not going to work. Right? So they're not hearing you when you're talking about a diabetic diet. When they say I'd rather use a keto diet, well, that's incorrect. Okay, they're gonna require more teaching. Which nursing intervention will enhance the learning for clients who speak English as a second language? Everybody get this one correct? Creating a pamphlet in the client's primary language. That's the most important. That would be one of the most important tools.
Yes.
Right?
Yes, tell me about it.
I'm sure lots and lots of people work with clients or people that English is a second language. It's always best to try and figure out how to communicate with them in their primary language, right? Home health nurses reinforcing education on the use of a glucometer, which approach would be most effective. Again, another keyword, most effective. Did anybody select anything other than A? We want to demonstrate, it's that teach back method, right?
Yeah, retroalimentation.
Yeah, we want to demonstrate and then have them return the demonstration. That is
It's how I learn more in hands-on.
It's a very effective teaching strategy, the teach back method. The home health nurse is reinforcing education for an 8-year-old client with diabetes. Which approach would be most effective?
This one, teach through
Yep.
with a toys.
Did anybody select anything other than A? 8-year-olds can't handle long comprehensive sessions, right? We don't want to just teach the parents and exclude the child because the child has to be part of that. Okay. And kids at 8 aren't going to plow through written pamphlets, right? So the way I would teach younger kids in the schools, their diabetic care is exactly this: toys, dolls, pillows, how to give injections into a little pillow or a toy doll. Okay, they hands-on. Which nursing intervention is a priority for a client who's not motivated to learn? There's lots of clients that are not motivated to learn. Okay, so which would be a priority? What do we have to do first off to establish a relationship? Well, we need to establish trust,
Trust.
right?
Yeah,
Trust and rapport prior to attempting education. Occupational health questions. So the occupational health nurse is caring for a client who reports lower back pain that's worse at the end of the workday. Which nursing intervention is a priority? What could be going on?
Bad lifting techniques.
Backs,
Yeah.
healthy for the movements, health.
Mhm. I mean, the other 3 answers are inappropriate. We wouldn't provide a local list of local massages. We don't even know what's going on,
Yeah.
right? Recommend the use of certain medications. No. Obtain a referral. No. We need to assess their lifting techniques and body mechanics to make sure it's not something with regards to that. Which statement is true regarding the scheduling of client education? Do we do it when it's most convenient for us? No, we do.
No.
It's most convenient and comfortable for the client. Maybe they
Yeah,
want to
where
finish.
it's more quiet, when it's not tired, nothing to do, or have distractions. When you have more time,
Maybe they want their family there.
yeah.
Maybe they want somebody who's going to be caring for them when they get home to be present. So however the environment, whatever the environment works for the client, we need to make that work. Okay. Any questions on, they're pretty simple questions. Any questions on the quiz? All right, let's go. Can you still see my screen? Let's go through the content here. Occupational health, environmental health, barriers to learning, and reinforcement. Okay, so what's occupational health? Where does that take place?
In the workplace.
In the workplace.
The workplace.
In the workplace. Okay, the occupational health nurse has a pretty big and important job. Okay, her job is to keep the employees healthy, safe, and at work. Right? She needs to have a good understanding. Think about a big hospital. Think of how many job descriptions there are in a hospital. I'm just using that for an example. From environmental workers to food workers to different kinds and levels of staff to the OR, radiology. Think of all the different job descriptions people have. Well, occupational nursing is about understanding what people are required to do within their scope of practice, right? So we all know when we start a new job, we always get a visit from the occupational people, don't we? And they go through whatever training we might need, whatever information, training we would need to be able to do our job safely. Okay, so they're responsible for not only the workplace, but also clients in the workplace. What if there's a particular unit that has lots of falls? Okay, they have to look at that as well. Okay, so they're looking at injuries, diseases people can acquire from employment. Okay. One thing to remember is there's really no work environment that's risk-free. None. I mean, let's take a bank. Okay, maybe there's stairs going into the bank, right? Maybe there's the ice doesn't get removed, right? Think about a salon, a nail salon or hair salon, and the different environmental items that are in those. So no work setting is completely risk-free. Okay, every single industry has its hazards related to work. Okay, so if you're working with an occupational health nurse or you're working in an occupational health setting, you're going to be case managers. Think about it. Let's say there's a work injury. Somebody hurts their back and they're off and they have back surgery. That occupational health nurse has multiple duties as a case manager, right? Identifying what the injury is. How long are they going to be off work? What kind of leave are they going to be on? If they're coming back early and say a limited duty, is there another job that they can go into until they can go back into their regular job? Working with insurance companies, working with doctors, working with therapists. Okay. The other job of an occupational health nurse is not so much injuries on the job, but keeping people healthy. Okay. Think of how many people come to work with mental health issues. Think of how many people come to work with substance abuse issues. They have to be in tune to that. There was a question, I believe, on your last exam that's related to not reporting, right? It was ethics, right? If you have an employee who's you're working next to that's impaired, you have a duty to report that. Lots of occupational nurses and departments do healthy planning, healthy promotion, health maintenance. Diet, exercise, balancing work and personal life. Has anybody heard? You should all have heard of OSHA. Anybody know what OSHA is?
I never heard of it before I read it in the weekly readings.
Right, it's your Occupational Safety and Health Administration. Okay, they're responsible for making sure your employers enforce the safety protocols that are in place. Safety protocols look a whole lot different from a hospital perspective to a restaurant to a hair salon. Everybody has different standards, but OSHA, okay, they're the
They are
agency.
they are who are in charge to check in every places if they have the exit for emergencies, everything for hazards,
Yeah, I mean,
poisonous, what to do for poison situations,
exactly. Poison control.
poison
It-
control,
OSHA.
extinguish for the fire.
Yep. Well, if there's an incident on site, let's say there's an unexplained death in the OR, or there's somebody falls, an employee or a visitor falls coming in the front door. Right? They're going to come out and investigate those things. And they're going to figure out what did that organization not do? What was incorrect? I mean, you've all worked in a place where everybody flips out when you hear OSHA's coming, right? What are some prevention levels with occupational health? So primary, teaching coping mechanisms, providing healthy diet and education, educating the use of proper lifting, right? Using protective equipment. Secondary, maybe your employees are working in a plant that is noisy. So For secondary, for screening, maybe you're doing annual screenings for hearing. Maybe you work in an environment that requires blood pressure screenings, screening for stress, screening for burnout. And then the other thing we have to consider is workplace violence. Right? That's in the workplace. That's occupational. That's the occupational health department or nurses' responsibility to be identifying who's at risk, who's potentially at risk for carrying out any kind of workplace violence.
For example, we are doing our clinicals, and there's a nurse with 30 patients. So it's a lot of stress can cause burnout. So who is in charge? So
Who's watching that?
yeah,
Yeah,
because give a good care for the patients like that.
yeah. Who's keeping an eye on those employees that are being reported for, say, bullying or harassing?
Mhm.
I mean, there's a lot of abuse and mental health that is out there. People bring that to work, right?
Yeah, so all that is part of our secondary prevention.
That's secondary. Now, when we get to tertiary, an example of tertiary would be, say they already have an injury. All right, say they're recovering from an illness or an injury, right? So we would be providing specific instruction or education of what's going to be required for them to return to work. Right? So let's say somebody had an injury and they had carpal tunnel surgery. Before they come back, you need to make sure that all the recommendations from the physician are in place in the work setting, right? Do they have wrist splints? Do they need a back brace? Do they need a different desk setup? So
So that would
occupational,
be secondary or tertiary.
that'd be tertiary. If they're, if they've had surgery, they've had the condition, they've had the illness or injury, and they're coming back in. Part of the occupational health nurse is that employee is prepared to come back to work, either limited duty or full duty.
It's basically like how we see in the first exam, where it's for the community prevention, education, prevention,
Yeah.
and the treatment. But now it's in the settings,
In the work setting.
in the work setting.
Right. So that occupational nurse is her job is to maintain safety in the workplace, right? Keep those employees at work. If they're out of work for any particular reason, how do they safely transition back into the workplace? A lot of workplace injuries. Okay. Are the staff trained for whatever their job description asks them to do? What if they're pushing and lifting? What if, let's say they're in the transportation department. They're lifting patients out of bed, into wheelchairs, onto the operating table. Do they have appropriate training for lifting as to prevent back injuries or any kind of injury? Right. That's why when you all start new jobs, we all get training in those kinds of things. Does that make sense? Environmental health. We don't typically think of all the risks and associated with living in, let's say, where you live now. Do you live near an airport? Do you live near a big transportation hub? Do you live in an agricultural community? Do you live in an industrial community? Do you live by water, lake, river that could have potential water contamination? You think of all the environmental risks that are within our communities. Think of everything we have in our home, from chemicals to pesticides to herbicides. Everything we have in our garages. Just think about doing a windshield survey around your neighborhood. What environmental risks do you see? What environmental risks are in your neighborhoods?
A lot of really bad roads,
Bad
potholes.
roads, yep. What else do you guys have in your neighborhoods?
Homeless people.
When we think environmental health, we think air pollution,
Air.
water pollution, maybe food contamination,
The noise, the
noise.
airplanes.
Or
Yep.
trash. We need to clean
Yep.
up the city.
Yep. Is the community littered with trash? Or is it clean? Are the parks inhabitable or are they not? Is there a high rate of violence? These are all environmental risks in your community. I mean, I tend to just make the assumption that the air that I breathe is okay. But I live next to a major highway, huge highway that goes from the East Coast to the West Coast. I'm sure the air quality around my backyard is not great. Right? What about if you live near a waterway or stream or river and things are getting dumped in there? There's just so many things to think about, right? And we know that kids in general are much more susceptible or vulnerable to environmental hazards, right? Which is going to lead to much more adverse health outcomes. Okay? Lead poisoning. What did you learn about lead poisoning?
It causes cognitive delays, developmental delays.
And where are you going to find potential leftovers of lead?
In before
Really?
1978,
Houses.
before 1978.
Buildings and the scratch for the paint, all
Mm-hmm.
this.
Yep. What about live in a community that has a high poverty rate? Right, they're much more that population is much more likely to be exposed to environmental hazards, maybe due to crowded living conditions, maybe living closer to hazardous waste sites, maybe having poor quality foods available, don't have big grocery stores, more hazardous jobs. And like you said, maybe living in the older homes with lead-based paint, which also includes schools, the older schools, older daycare centers, right? So when we're doing, let's say think of nursing process here. Let's say we're going through the ADPI and doing an environmental assessment. What's going to be important what important information do we need to seek out? Let's say you're doing the environmental assessment with a family in the home. What's going to be important to know?
A family history of any
Family, yep. Where they live, right? Where they work, where they send their kids to school, maybe a dietary history. Remember all the mercury? If let's say they're fishing for their dinner in local waterways. How close do they live to factories, to dump sites, to major transportation routes? If they live, let's say rural, they live in an agricultural community. They're overhead spraying of pesticides and herbicides for the agriculture. It's just things we don't think about, right? Until you're affected. Like you said, lead-based paint was used in homes before 78. And that was your second quiz question about the younger kids with their proximity to the ground, putting everything in their mouths, including lead paint chips, right? Pesticides in homes, schools, daycares, hospitals, lawn care, farms. We know the kids are much more sensitive to the effects of toxic chemicals. right? Exposure to toxic chemicals, think about during pregnancy. Can cause issues with fetal development, miscarriage, stillbirth, or maybe some developmental abnormalities, including childhood cancer, autism, ASD, autism spectrum disorder, right? We know that 30 million Americans drink water that does not meet the EPA safe drinking water standards. What's the EPA?
International population, whatever.
Nope. Environmental Protection Agency. They're the federal agency that's oversees drinking or water standards. All right, so it's estimated that over 30 million Americans at this time don't have water that meet the safe drinking water standards. Okay, soil is a factor in that as well. The quality of the soil is also impacted by chemicals. Okay, of what we use, herbicides, pesticides, fertilizer, pollutants from the air. Okay, also 50%, it's estimated that 50% of Americans live in areas where the air quality does not meet the national standards. Motor vehicles, the greatest single source of air pollution. Okay, air pollution has lots of environmental risks: asthma, respiratory disease, cardiovascular disease, cancer, immune system issues, reproductive issues. Okay, and then food. Think about food contamination. You know, if I go to a restaurant or I go to a drive up, I just assume that my food is being prepared correctly. Do you? You just make that assumption. Well, what if it's not? Okay. What if the food isn't being prepared thoroughly? Let's say chicken, the risk of salmonella, E. coli in the beefs. Okay. If there is an outbreak, let's say there's a food poisoning incident in a community, I think that wasn't one of your discussion questions. That's in one of the RN discussion questions. But one of the discussion questions is that so many kids show up in an emergency room with the same symptoms. Go back and investigate. So as it turns out, it's a food poisoning issue that happened at a local restaurant. All right, so what's the job of the public health community health nurse? Okay, that's the epidemiology. I don't think we've gotten to epidemiology yet, but that's where the nurse goes back and investigates how it started. What was the food? Who's affected? What do you do? What are the corrective actions? And that would be an OSHA visit as well. And then I don't know if you know, but you can actually, through the EPA, go in and put your zip code in there, and it will give you, based on your zip code, what environmental risks are forefront in your community. Okay. So that's our environmental health. Any questions about that? Barriers to learning. Okay, a great part of our job in community nursing is teaching, right? Patient education, right? Patient education, we know, is one of the most important roles for the nurse, right? Why do we use education? Promote health, prevent illness and injury, improve our health decisions, enable patients and their families to care for themselves and family members, right? We know that when patients take personal responsibility for their health, they're more effective in making the change and maintaining those changes. Okay, education empowers our clients with more knowledge and motivation and helps them take personal responsibility. We're educating in every role we're in, correct? One of the biggest issues, one of the biggest barriers to learning is low literacy. What's low literacy? What does that mean?
Not being able to read. Well, English
Okay.
might be the second language.
Okay, what
Just,
else?
Uneducated, like some people they drop out,
Mhm.
and don't finish high school and stuff like that.
Okay. Okay, low literacy is a huge issue. Nurses are often working with clients who either are illiterate or have low literacy levels, right? And clients may be embarrassed to admit this, admit that they can't read to their healthcare providers, or they can't understand what's being taught to them, or maybe discharge instructions. They don't understand it. So what do? One of the ways that we can assess our client's ability to read is to have them read something back to us. Right? Can they read something back to us? Can we ask them some questions to see if they have the comprehension? I mean, think about the different cultures. We talked about this in the early on. Think of all the cultures that English is their second language. They're a huge language barrier. They may not only understand the language. If they can't read the language, they can't understand it. So do they even understand what the provider's telling them? Okay, so how do we assess the client's readiness to learn? All right, motivation. We've already talked about motivation. We talked about that, I think, in week 2. Right? The goal is to motivate our clients to return or get as close to being independent as possible, right? Into their home setting, right? We need to be able to communicate how serious their high blood pressure is, how serious their heart disease is, right? Showing them, telling them the advantages of interventions. Let's see, Healthy People 2030. You should take a look at Healthy People 2030 with regards to patient teaching, right? Most of their goals with regards to patient teaching are related to education. Okay, their goals are to prevent certain conditions, reduce risk of illness, promote a healthier lifestyle. So please review the Healthy People 2030 objectives for patient teaching. It's right in their website. And you have the link to that website from week 1, I believe. Okay, so people learn in 3 different ways. Okay, they learn visually what they see, they learn orally through what they hear, and then kinesthetically by actually performing. That's the hands-on. Right? One is usually more dominant, but everybody possesses all 3, but one is usually more dominant. Okay? And the domains of learning, there's 3 different domains. We learn cognitively, we learn affectively, and we learn from psychomotor. Okay? What are those 3? What's cognitive?
The way a person thinks.
That's the thinking part. So it's your ability to read information, to understand it, maybe to memorize it, and use it to solve problems. That's the cognitive domain. Affective, what is that?
A person's attitudes and beliefs can
Mhm.
affect their ability to learn. So the feeling part.
The feeling part, right? Your attitude. What are your attitudes about a certain subject? What if you have a group of people you're teaching and half of them don't believe in the subject that you're teaching, but they're forced to be there? Are they more or less likely to learn? Much less likely, right? So it's the attitudes, feelings, beliefs, values. These definitely affect their ability to learn. And then psychomotor, okay, that's the doing, right? So that is that teach back. Okay, the moving part, learning a skill or a task through practice and experience. And you're going to get asked about these on the next exam. So know these. But remember, psychomotor is doing. It's not, believing in what you're doing. That's affective. Psychomotor is the actual doing. All right, so an example would be, I'll go from my experience as a school nurse, teaching a kid how to use his glucometer. Right? Psychomotor is that practicing over and over and over again. Me demonstrating, them demonstrating back to me. Right? Give me another example of psychomotor learning.
Teaching maybe a child how to perform an injection of insulin,
Mm-hmm.
just showing them and then them doing it back.
Mm-hmm. Yep. Practicing a technique. Maybe it's helping a family member learn how to change a dressing for when their family member comes home. Right? You're teaching them how to do it, and then they're showing you what they learned. Okay? So, reinforcing health education. Okay? Health education is typically done in a collaborative form or format, okay, where lots of disciplines are involved. Okay? Everybody brings to the table their own expertise. Okay, so in the schools, it was the nurse. It might have been the physical therapist, the occupational therapist, maybe speech therapist. Okay, so in the schools, health education was performed in a collaborative team. Right? The ultimate goal of patient education, prevention of illness, promotion of wellness, and restoration of health. Right? So we as nurses, we teach patients about their disease or disorder or injury, surgery. Okay, it's one of the most important roles for us as nurses, right? We perform it in every setting that we practice, right? And if you think about education in the nursing process, right? So I'm here, I'm in this, where am I? I'm right here. Patient education involves analyzing and assessing data, and then you establish some objectives or goals, creating a plan for assisting the patient in achieving these goals, right? And then evaluation. How do we do? Okay. When do we start discharge planning?
Upon admission.
On admission.
Admission.
Right? Discharge planning requires that we look ahead to meet the patient's ongoing needs at home. Right? It's a process that begins at the time of admission. Assessing for whatever special needs they might need, education material, what do their family members need to know before they come home? Some intervention levels with education, primary prevention. Here's some overall, just general examples. Teaching women to void before and after sex, to prevent cystitis, teaching parents how to role model healthy eating, educating parents on immunization schedules and what diseases are prevented. Does that make sense of why it's primary? What about secondary? Maybe teaching about the signs and symptoms of a UTI, preparing somebody for a colonoscopy. Tertiary, the patient already has hypertension, so we're teaching on the benefits of low sodium diet. We talked about the demonstration and use of a glucometer with diabetic patients. And then tertiary, again, discussing the potential side effects of a prescribed medication. They're on the medication for something, right? So if a patient starts a new medication and you're the nurse doing the home health visit, reviewing the medication, reviewing the potential side effects, and what to report. Okay. So those are the four concepts. I know we covered them quickly, but I wanna go to the, do anybody have any questions about any of those? I wanna go to the HESI prep. That's what I wanna work on for a little bit. So I want everybody to pull up their HESI prep assignment. It looks like this. Whoops. Let me share. Okay, it looks like this. Everybody have it pulled up? So, as you're working on this, okay, I want you to think, I'm looking at the directions now. Nursing process, ADPI, when you're addressing completing each topic. So each topic will require critical thinking skills of how to apply the nursing process from assessment to evaluation. Okay, so remember, this is a study guide for you. This is going to be your study guide for the HESI. So whatever you want to put in these boxes with regards to the nursing process. So for example, on anthrax, now we haven't done bioterrorism disaster yet. So, but once we do, so think about what do you need to know? What's important to know of a client that maybe has been exposed to anthrax? Okay, so here I think of, you don't have to list out A, D, P, I, E. Okay, I mean, some people put a couple of sentences in each box, and others, do a more detailed. It's whatever you want to put in there that you're going to remember, so that when you get a HESI question about anthrax, okay, well, let's think nursing process. What might they present with? Right? How is it transmitted? What protective equipment do you and others need? How is it treated? Does that make sense? So let's skip to what we have done. We haven't done disaster yet. We haven't done epidemiology yet, but we have done some health promotion and teaching. Now I realize that every box on here I haven't covered, but I've covered the concept it falls within. Okay. Each box represents a question on HESI. I've gone back to HESI. Okay, I know the topics they're asking about. Okay, so you're going to get asked a question about how do you assess obesity? Question about lipid screening. Question about conjunctivitis assessment and home care. Viral conjunctivitis safety. Infant death rate resource. So here, where do we get infant death rates? What's the resource? Where are we going to get that? Probably the health department, right? The local health department. Where are we going to get infant death rates resource?
Where would it be?
Local health department,
Oh.
right? Or your vital statistics. Again, I don't know what the questions are, but these are the topics. How do we assess obesity?
Through like the BMI.
The BMI. What else? How else do we assess obesity? Think, what are we going to, well, what about assessing for obesity am I going to get asked?
Like how often do
you
you exercise? What type of foods do you eat?
Yeah. Yeah. So that's what you need to be thinking. Lipid screening. Why in the world would they be asking about lipid screening with regards to med surg or
Cholesterol?
community nursing? What are they looking to find?
High cholesterol levels.
Yeah. Why do you do lipid screening?
To assess for high cholesterol or high blood pressure.
Mm-hmm. Conjunctivitis in the home. And what do we know about conjunctivitis? Maybe what might a kid present with? Purulent drainage from the eyes, redness, itching. How do we do that assessment? What's the home care? It has to be treated, right? Eye drops. Okay, eczema with school sports. Why is that important? Why are they asking about that? What do you think they're going to ask about eczema in school sports?
Eczema to dry skin.
Right? But why is it related to school sports?
Saying eczema.
Eczema, yeah, within school
It could be
sports.
related because some people could I know grass can irritate eczema because my daughter, she has it.
Okay,
Um,
what else?
That's the answer you was looking for. But
Yeah, no, well, I mean, it's it's what we're all looking for. But this
avoid
is
known triggers. Avoid triggers.
exactly. Yep.
What is the causes and how it is signs and symptoms?
Mhm.
How to prevent the care?
Well, and
of-
how is it treated? I mean, we want trainers in
Antihistamines?
school sports to know who has what health conditions, right? And how they're treated. Lead poisoning, action, quality care, high school population. I mean, what do we think they're going to ask about lead poisoning? Action, what's the action? I mean, what would a kid present with lead poisoning with?
Lethargy, they
Hmm.
lower more, many things.
Developmental delays. Cognitive delays.
Yep. Heart healthy diet. So again, I'm just going through the elder health assessment. What do we want to know about what kinds of things are important to assess when we're doing an elder health assessment? Maybe nutrition, risk factors, safety risk factors in the home if they're in the home, any kind of abuse or neglect that might be going on. Vision screening in preschool. Why do we do vision screening in preschool?
To detect early causes so that you can fix them early.
Mm-hmm.
Like
Mhm.
glasses.
Yep. Or when is the earliest screenings we do for kids? They're done in preschool,
Is it 4, 5?
3 and 4. Scoliosis, that's in your common childhood ailments. How do we screen for scoliosis? Scoliosis screening priority. The X's, the ones that have X's in them are the new ones that I added based on last term's HESIs. That's how recent it is. So I've updated this. So scoliosis screening, right? Look back on your notes for scoliosis. A lot of this information that you can fill into this comes from your weekly notes. Not all of it, but a lot of it, right? Primary prevention with adolescents. Well, let's see. Adolescents are riding bikes, driving cars, right? Maybe we're teaching about seatbelt safety, car seat, or seatbelt safety, or driving impaired, those kinds of things. Or here's one: seatbelt safety adolescents, adolescents health teaching, community education, evaluating community education. We just talked about that a few minutes ago. How do we evaluate effective education in the community? So I know it seems like a long list of things, and I know that some of them look repetitive, but like I said, each of these boxes represent a question on HESI.
What does it mean, like, to have the stuff that says Meals on Wheels?
Yep.
What are you supposed to write in that box?
So
What
let's
it-
see,
what Meals on Wheels
community
is?
resources, rural, that's in your rural notes. right? What kind of community resources do they have or lack of? Right?
Oh, I'm looking down further. It says like
Oh.
food stamps. Like what would we write in this box that says food stamps?
Food stamps, Meals on Wheels. There was a question asked about each of these. You know,
Oh,
what it
so write
is.
what it is?
Yeah,
Okay.
yeah, what it is. It's a.
That is for the rural, the population for the rural.
What?
That one says for the population for the rural population.
For the rural population, right. We're in the section of health promotion and teaching. So it's kind of all over the place. Okay, Meals on Wheels isn't just for the rural population, but what is Meals on Wheels? It's a free service. When you look it up, it's a free service to elderly clients on a daily basis or weekly basis, whatever you find. Okay, same with food stamps. Maybe who qualifies? Who qualifies for food stamps?
Okay.
And what do they qualify for? What is WIC? Is it just food stamps or is there other resources tucked in there with it? When we're looking at an elderly diet, right? What kinds of things do we talk to the elderly about with regards to a healthy diet?
Low sodium.
The section on home health care.
Is HS heart failure? Is that heart failure?
Yeah, heart failure in the home. NG tube feedings in the home. And I told you that this community, HESI, is very med-surg focused. Very med-surg focused. So heart failure in the home, feedings in the home, what's respite care, falling in the home, what do we need to look for? So just think ADPI, think nursing process. So falling in the home, how would we assess that somebody's at risk for falling in the home? Let's say they have non-stick rugs all over the place. So that's our assessment. What are we going to do? We're going to remove those rugs, replace them with whatever, right? And then evaluate the risk being lowered. Suspected home abuse. What are we looking at? What kinds of red flags would be present for us to suspect abuse in the home? This one's about below the knee amputation home care assessment.
Oh,
Okay.
and what is it? Below the knee.
BKA, below the knee amputation. COPD. What do we want to know? What should we know about how do they accomplish their ADLs at home if they have COPD? Do they need to rest between meals? Do they need to keep their oxygen on while they're eating meals? This whole section is med-surg. BKA, COPD, cirrhosis. If somebody has cirrhosis, what's an ascites? They have ascites with the cirrhosis. What's a home diet? So I know it seems like a lot, but this is what's asked. So as you fill this out, think about what you would want, what you think is most important to know for each topic. And think about, with each topic, what are they going to ask me about a home diet for a client that has ascites from cirrhosis? Well, there's specific teaching bullets that you teach about an ascites diet. What is that? You should have learned that in med-surg. Somebody with cirrhosis. What do you want them to avoid for food? What should they increase? What should they decrease?
Salt, protein, decrease salt, decrease water.
Um, home safety post arthroplasty. What does that look like? Post cabbage. This is all the med surge part of it. Does that make sense? So the reason why I'm asking you to start this is because there's many areas that you can fill out already. And if you pull up this blank document in week 8, it's going to be a very long and tedious assignment. Where the purpose of this is for you to be trying to complete it every week or every 2 weeks on what we have covered. And again, specific boxes may not be covered, but the concept. So the concept of health promotion and teaching. Okay, we started that today. All these questions under health promotion and teaching fall under that concept. I'm going to send you guys well, I changed this up just a little bit this term. I'm going to send you guys a sample of one from last term. It's not going to look exactly the same because I tweaked it again. I try and tweak it every term based on the HESI. Like what I saw last term for HESI topics was a bit different from the term before. So I updated that HESI prep assignment and took out the topics that I didn't see last term and added in the topics that were new. Does that make sense? So this is as close as you're going to get to knowing what's on the HESI. I didn't just pick out all those boxes out of our readings and out of our notes and exams. I took those topics right from HESI. Okay? And remember, yes, it's a community HESI, but it is very med-surg focused. That's why you have a lot of med-surg boxes on there. And I don't cover that in class because my expectation is that you get that in med-surg, right? Questions? Remember, it's your study guide, so build it as you want to study. But be thinking, what question? What am I going to get asked about that? Just think of 2 or 3 questions that you might get asked about each of those topics. Again, I don't have any clue what the questions are. 0. HESI's done through a big data bank of 1,100 questions and they put it together. It's changed up every term. But I do know the topics that they're asking about. So at least that's a start, right? So if you do it at the end, you're probably not going to get a lot out of it if you're just rushing through to put anything down. But if you're spending some time on it throughout the term, I think it will be very beneficial to you. And there's no right way and wrong way to do it. Okay, so just think, if you were a nurse, how would you be assessing safety in the home of an elderly client? What do I need to know about conjunctivitis? What does it look like? How is it treated? Again, there are right and wrong answers, but as much as you want to put in there is as much as you will have when you study. And the nice thing is it's a working document, so you're almost studying as you're completing it, right? Because you have to look up the topics, whether you go back to your notes or you go to your med-surg book. I mean, think about it. You've got your fundamentals book, you've got your med-surg book, and you've got your maternity and peds book. Everything in that HESI prep can be answered within those books or within the notes, right? Okay. Questions about that? Is that helpful to just kind of look through it?
Yes, it was. Thank you.
Are you more clear on, like I said, there's no right or wrong amount of information. It's whatever you feel is going to be helpful for you to prepare. All right. I want to take a look at the shoot. I want to take a look at the exam 2. Everybody should have this. Right? You guys see my screen? Okay, everybody
Yes,
should
I-
have this. I sent this early in the week. No, when did I send this? Last week. All right. So we have covered all 3 weeks. Okay, 4, 5, and 6 after today. Okay, so that study guide, this study guide should look pretty darn familiar. Okay, this study guide, like the first one, was built. I built it from lectures. I built it from reading, your reading assignments, including the Canvas module reading, your book readings, and your notes, weekly notes. All right, so most of this information in here should look familiar. All right, so we actually have quite a bit of concepts to cover, right? Your special, from week 4, your special vulnerable population, specifically pregnant adolescents, LGBTQ, mental illness, and alcohol, tobacco, and other drugs. Hospice and palliative care, death and dying, faith and spirituality, and ethics. We covered those 2 weeks last week. And then today we covered occupational health, environmental health, barriers to learning, reinforcing health education. And I also copy and pasted all the readings in case you want to go back for weeks 4, 5, and 6. Okay, all your readings are in there. Okay, it's the same kind of exam. Anybody who struggled with math on the first exam, I've actually met with quite a bit of people already from exam 1. Very, very helpful. If you're struggling, if you continue to struggle with math, because these are simple math questions, you really should be getting these math questions correct. Please, please go back and review that tutoring session I sent you in week 1 from Professor Bogart. You have it in your announcements. Okay, Professor Bogart does a really very basic math 101. And it covers all these kinds of questions. Okay, it's not a complicated tutoring sessions. It's very, very easy. Okay, so if you struggle with math, please go back and review that. So I have organized this to kind of methodically go through the concepts in each week. Okay, so it should be very easy for you. It should be an easy flow. Okay, I would start with this. I told you this for exam 1. I would start with this concept guide. Okay, if you feel comfortable with the concept, move on. If you don't, and you feel like you need a better understanding of it, go back to your readings, go back to those weekly notes if it was in week 4, 5, or 6. Read that section in detail. So this concept guide is an abbreviation of your notes. This is the important information from each concept that you're expected to know for the exam. Okay, that's why I said start with this. And then use all your other tools as additional resources. Make sense? So pregnant adolescents, LGBTQ, mental illness, anxiety. Don't forget about eating disorders. Okay, we didn't really cover that in class. Okay, but it's within here. Okay, and it's within your reading in week 4. Where is it? Right here. Right here, chapter 47. Make sure you have a look at eating disorders. Okay, that's why it's on your concept guide. All right, so look at that. Substance abuse. Oh, I didn't make a Shoot, shoot, shoot. I'm just gonna change this. If you guys would just make a note here that this is, sorry, just make a note here. I'm just gonna change this up right here. Week 4. Okay, so that's week 4. And then it ends here. Okay, this is week 5. All right, week 5 starts with death and dying and palliative care, hospice and palliative care. Okay, so add that in there. And then week 6 starts here. Sorry about that. Week 6. Okay, starts with occupational and environmental health and client teaching. So this is really what you need to know for the exam, what's in here. Okay? I tutored one student and I don't think she's in this class, but anyway, she said I was asked, how do you prepare for the exam? And she hadn't even looked at the study guide. And so really, this is an important part of your preparation. Okay? This particular study guide. You have a good understanding, and I don't mean memorize it, but remember, just like your quizzes, the information is meant for you to understand so that you can apply to practice. You know those fancy words, critical thinking to clinical judgment. All right, so you have this knowledge. Now you need to apply it to caring for your clients. And that's what your exam questions are. They're clinically focused. And that's the next gen format. Okay. Okay. Questions? Helpful?
Yes, thank you.
I mean, you guys as a whole in this group did fairly well on exam 1 as a whole. You guys
Okay,
scored
thank
quite
you.
high. So very proud of, so just do the same thing. Okay. And then after you finish studying towards the end of this week, if you still need some help and don't understand some of the concepts, please reach out to me and we'll schedule a tutoring session. And it may be a 5-minute tutoring session or a 30-minute, whatever you need. All right, don't go into this next exam not understanding the concepts. All right, so I'm available to help you at the end of the week or even next weekend. Right, because you'll be taking the exam on Monday. Okay, so we covered a lot today. Hopefully it was helpful. Don't leave that HESI prep to the last minute. Don't. You can just go into your books and find all these topics, can you not? The ones we haven't covered in class. So, okay, any questions? Why
No,
does
thank you
everybody,
so much.
why does everybody look so? Because it's Monday?
No, because we wake up more early today.
You what?
We wake up more early today.
You wait.
We got an extra hour.
Yeah,
Oh, yeah, God, it got dark early last night.
I have less hour.
Oh, yeah, I'm kind of messed up today too. From that, yeah.
But we got an extra hour.
I know, but still, it's, getting dark at 5 o'clock is,
Yeah.
Whatever. All right, well, I hope you guys have a good rest of the week. Please reach out
Thank
if you
you
need
so much for your
anything,
help.
okay? You're
Thank
welcome.
you for your help. Have
All
a
right.
good
Thank
night.
you. Have a good one.
Bye-bye.
Have a good
Bye.
one. Bye.